Welcome, everybody. Welcome to all of the How Council for Home Care and Hospice members who have joined us to watch today's Hot Topic Member Updates podcast. Yes, you heard that right. We are not doing this as a live webinar this time around. We are changing it up. This is a grand experiment. We are recording the updates from the team, and we're going to be sharing it out to members far and wide. So I'm going to kick us off with just everybody say hi and introduce who you are. I'm Drew, Communications Director at the Council.
Good afternoon, everybody. My name is Lisa Von Lemden. I'm the Executive Director of the Ohio Council. Christy, take it away.
Thank you. My name is Christy Piles. I am the founder and CEO of In Your Corner Consulting, and I am the EBV subject matter expert for OCHCH.
Cheryl.
Hi, I'm Cheryl Meister, and I'm a member of the expert panel, and my specialty is Medicaid rules.
So much fun and so necessary. All right, Hope.
Hi, I'm Hope Mollican. I'm on the board of directors for the council, and I help with the help desk and patient advocacy.
Thank you. And everyone's favorite colleague and community relations specialist, Jen, introduce yourself.
Here, buddy. Hi, everybody. I'm Jen Goldsberry, Director of Community Relations. I hope I've met you. If not, please call me and tell me to come visit you anywhere around the state. I love traveling around, so hope to see you soon, especially this summer as Ohio roads are clear.
That's fantastic. Thanks, everybody. And this is a big experiment. As you can tell, we don't have it all planned out. So we're going to go through this. We've got some amazing content and updates, and we're going to kick off with Lisa. So Lisa, the spotlight is yours.
Awesome. Thanks, Drew. Well, you know that we are in the thick of the budget as we speak. So let's just, actually, I'm going to set that one aside and let's go through some of the updates in regards to the events that we've got going on here at the council. Super excited to promote Dr. Dan Doherty and Brain Trust and the leadership program that they're going to be kicking off in July. It is actually an event up on our website. If you haven't heard Dr. Doherty speak either at the annual conference and trade show last year as a keynote on day one, or as a keynote at the spring conference this past March as a keynote on day two, I would highly recommend taking a look at him. Phenomenal speaker, really takes the science of how the brain works, how hormones and the various different things coming at us affect how we react to things. And then from a leadership and managerial standpoint, helps us understand how the folks that we're trying to lead and excite and stay motivated on a daily basis all ties together, and how we can, retain staff and really be more thoughtful about how we lead our crews as we move forward. So Dan's an amazing guy. He really hits it hard in regards to, appropriate and fun ways to communicate, but at the same time, he's very understandable, and I just love hearing him speak. So if you haven't seen it yet, go to the events page, take a look. Dr. Doherty, I think, kicking off on July the 17th, leadership series that will be 6 sessions over the course of the next 3 to 4 months. We do have a golf outing coming up. Our annual pack outing is on Monday, July the 28th, here at Red Tail Golf Course in Avon, Ohio. We're hoping to stay a little drier this year. For those of you who were out on the course last year, we essentially had torrential downpours from about a half hour after we teed off until they finally called it around 2:30 in the afternoon. So, hopefully Mother Nature won't hit us twice. Please do join us at the golf outing. It is $250 a person or $1,000 a team. There are sponsorship opportunities available. All of the dollars for the teams go directly to our PAC, which supports both our federal and state advocacy initiatives. Let's see, what else do we have going on right now? The annual conference and trade show is coming up in September. We did move the date up a week, so I believe we kick off on September the 15th, or is it the 16th?
15th and 16th.
The 15th and 16th. And that is going to be at the Renaissance in Westerville. Again, if you haven't registered, please do. Our lineup is amazing. Katie G and the team put together a really thoughtful crew of speakers and educators that really hit on all facets, be it hospice, private duty home care, skilled home care, the Medicaid world. There's a little something for everybody. So please do register yourself and possibly even consider maybe bringing some of your staff that don't often get to come to these types of events. I know I hear from time to time when there's a newbie that comes in or somebody that hasn't had the opportunity to attend a conference, they tend to take away even more than some of us who come to this thing every year, right? Because their brains are just open and they're sponges and they're ready to take it in. So please do consider registering not only yourselves, but also some of your colleagues to come into Columbus there in September. So, all right. I mean, let's talk about the big pink elephant in the room, our good old Ohio State budget. I'm probably going to bring Christy onto the screen with me because she's so much more eloquent and can probably speak to this way better than I can. I will just be very raw and say that, I was extraordinarily disappointed when Zach called me yesterday to tell me that basically the Senate went ahead and dropped their version and they pulled both our EVV language that we co-developed with Representative Gene Schmidt out of Southwestern Ohio and the Ohio Healthcare Association. And then they also pulled our workforce augmentation ask for $2 million to support collegiate level nurses and, partnering with home care agencies for internships, externships, and ultimately mentorships to help prepare a workforce that can hit the ground running post-graduation in home and community-based services. So that was a major disappointment for us. Now, I will also say that in speaking with Zach this morning, this is just, we had both of them come out of the House, right? And that's half of it. We had both of it pulled coming out of the Senate, and that's half of it. Now they're going to go into commission, and likely we're going to start kind of pulling and piecing and they'll start negotiating. So it's not a done deal. This is not the budget that they're passing, but we have work to do, folks. And I think I'd like to just open it up to Christy to hear your thoughts specifically on what you think about what happened with EVV.
Well, I will echo your statement in that it's very disappointing. I think that, where I think claims denials, it's going to happen. A lot of states are doing it. So it's not like we can fight to keep that completely off, but I think there's still a lot of room for improvement when it comes to EVV in Ohio and a lot of risk to providers, especially as we get into our partner payers like ODA and DD. We're still seeing some gaps there that we're having a hard time troubleshooting. So I think hopefully, ODM has been a good partner. So I hope that they'll come to the table if there are some issues we can't fix. Like one I'm going to talk about in my segment, but yeah, there's still some problems, and it's a bit disappointing that we didn't have a bit more breathing room to help work with everyone.
Yeah. Has anybody on the panel heard anything from any of the agencies? On Monday, June the 2nd, so just this past Monday, we did go live with EVV and the managed Medicaids. I had the pleasure of talking to one of the payers today, and I was shocked by this, but they said, here we are sitting here Wednesday morning at 10:30 a.m. and not one claim has come in on a G code for EVV. They have their whole crew waiting to help us all out and help us work through the details. And they're like, not one. And I'm like, not one agency in Ohio has dropped one visit G code to this particular payer, not one. So, I mean, Christy, are you hearing anything at all in regards to the managed Medicaid EVV?
Yes, I'm not super surprised about that. This is very similar to when we first went live in Ohio, and we were setting at ODM and Sandata, and we were just waiting for the calls to come in. But day one, you normally don't see the issues, and a lot of providers haven't billed, obviously. They haven't billed their May. They're still billing their May. They haven't even started billing their June yet. So maybe next week is when we could see, or even the end of this week, we could start seeing some phone lines light up.
Oh, I guess I cleared my calendar a week too early.
It's that hurry up and wait.
Right? Oh, wonderful. Well, I don't really have anything else. I just want to tell everybody, welcome to summer. It's first day that I feel like we're seeing what we would consider summer-like temperatures here in the state of Ohio. I know that does bring challenges with staffing. We've got vacations. The kids are going off school. Please stay safe and please know that, we're one click and one phone call away, and we're here to help and support in any way we can. So that's all from me, Drew.
Thanks, Lisa. Thanks so much. Good update, and thanks, Christy, for tag teaming on that one. Next up, Christy, you're still on the hook for a bit more. We have some EVV updates from you.
Thanks, Drew. As Lisa had mentioned, we were a little disappointed with what happened with the rule. But again, as she mentioned, it's not over yet. So we're still having conversations. And one of the things I would like to update on is that it seems as though there has been some issue identified with either SANDATA or alternate vendors, but there are quite a few vendors out there that are unable to send an updated client file to SANDATA, which would have cleared those red dots of terror that we've been talking about. So those unauthorized service exceptions that you see should be gray now, and the visit should be in a verified status. So if you were also struggling with your vendor to get a payer program or service updated in SANDATA, you should be able to bill those now without getting denials. I know we had a provider that hadn't been paid since March. So we happened to be on a call with them in ODM last week, and ODM let us know what was going on. I know that SANDATA engineers are still trying to figure out how to best get this out to vendors so that they can send it correctly to SANDATA. But I did tell ODM that a lot of the alternate vendors are looking at Q3 releases right now. So if there are any changes to the specs or any changes to their configurations, it may take some time for them to get it worked in. So just keep an eye on that. I am seeing some odd things happening right now where the claim should be paying. It matches everything perfectly to the remittance advice and in SANDATA, but for some reason it's not. So I encourage any providers who are experiencing this to please put in a ticket with SANDATA and let ODM know, because as we see, it took a few months to get this unauthorized service exception explored and turned off. So if there is a claims issue happening right now, matching issue, we definitely want to let the state know, and it needs to be volume. It can't just be one or two people, because then it's a one or two people thing. If everyone's having this issue, then clearly it's a problem. So if you happen across any of that in your remittance advices where everything is matching between SANDATA and on your remittance advice, please let the state and SANDATA know. And as Lisa said, we're always a phone call away. Please don't hesitate to use the help desk. Give us a call. We're happy to help you any way that we can. So that is all I have for EVV today.
All right, thank you, Christy. And just to take a little side trail, I want to mention that these podcasts are supported in whole and in part by our affiliate members. Without their support, we couldn't make all this happen. And this month's patient is supported by Patients Choice Laboratories, the folks at PCL. What do? They reduce readmission with molecular testing. And basically, it's a 24-hour PCR results program with resistance testing, treatment recommendations. They help you fight infections smarter. They have an adult brief swab that simplifies UTI sample collection, and studies show that their methods reduce hospital readmissions in the home health population. If you want to learn more about them, reach out to Mike, and you can contact us for his information. So thanks to PCL for helping us put this podcast together. Jen, I'm going to turn the spotlight over to you.
Great. Hi, everybody. I will again echo Lisa. Happy summer. We're so excited to be here with all of you and have you as our members. We're so excited. So I just want to mention a few things. One, we've been starting these networking and community learning events around the state. We've had one in Columbus in January. We had one in Cincinnati in April. And our next one will be in the Dayton region, June 18th. So if your calendar is clear, or even if it's not, clear it. You should be there. Come over, come across the state. If you're not in that region, it's a great time to meet people from that region. And then if you are, bring your team. It's going to be at Dayton Beer Company. The first hour from 3 to 4 is a really good education. We're going to have Hope from our team and Greg Davis and Kim King. They're part of our board. They're going to be talking about Medicare, Medicaid. Greg's going to dig into sales development, business development, scaling up your business. So we'll have a great conversation. These events have kind of lent themselves to be very conversational and great dialogue among the agencies, which is something I learned in 2024, going around and meeting with all our member agencies, is that you wanted to talk to each other more. So we're excited to do that and just continue the dialogue about opportunities across the state, hurdles, challenges, and how we can all work together to make home health and hospice great care in Ohio. So that's June 18th. Let me know if you want more information, but that's also on our website. Lisa mentioned the annual conference. I will just say that exhibitor and sponsorship opportunities are open. So if you have vendors that you're working with, or vendors or affiliates, if you're seeing this message, please sign up to exhibit and or sponsor. Awesome opportunity to get FaceTime with our 250 plus agencies that attend for 2 solid days. So it's going to be an amazing conference. Can't wait. We got a new venue this year. It's going to be really spectacular. We have room for, I think, over nearly 75 exhibitors and then lots of sponsorship opportunities. So that's September 15th and 16th. And I did want to just tag on one more date to the PAC golf outings. Lisa mentioned Avon, July 28th, and then we're doing a secondary event September 26th in Miamisburg at Pipestone Golf Club. So thank you for our PAC team who's helping to bring that secondary event across the state and in the Dayton region. So you can attend both. Two options there for you. Wanted to mention cost savings programs. We are trying to partner a lot more with our sponsors and affiliate members to bring agency members really substantial cost savings, cost savings on your services that you need to run your business. So ACHC and CHAP are great partners. If you're doing your accreditation or your reaccreditation, there are discounts on both of those things through both of those great organizations. Reedy Medical Supply is a new one. They are doing complimentary cost analysis of your medical supplies, and then they can just take a look. It's not committal. You just give them a list of what you're using, and they can come back and say, well, this is how much money we can save you through our services and delivery. So it's worth a shot to just get that done. And then we're working to add more all the time. So if there's something that you're using or doing that you're like, oh, it'd be so great to have a discount on this, let me know, because we'd love to engage more and more partners to increase savings for our agency members. And then new in 2025, we also started a newsletter focused on our sponsors and affiliate members, and they are submitting, special deals they may be running, special events they have coming up. So our next edition of that will be next week. We're targeting next Thursday to send that. So be sure to cruise through that, learn about the affiliate members that are part of our family and how they can help you, again, with your bottom line and also just increase your services. So that's that. And then membership, it's continuing to grow all the time. Thank you so much for your support. If you're a member, if you're not, please consider joining. There's an amazing suite of benefits and services that we do offer and resources that you're hearing about today, but then also visit our website for more info. I'm happy to visit you, chat with you, and guide you through all the different resources we do offer. So, and if there's anybody you're working with or any agencies that you know who are not a member, if you want to throw out a plug for us, send them my way, and would love to bring them into the member family. It's a really great community, and again, we're all working together to just do great work here in Ohio. And I think that's my spiel for now, unless anyone has any questions.
Thanks, Jen. Fantastic. I will take a moment because everybody's mentioning the annual conference. I had a meeting with Katie Gallenstein this morning. We were working through some of the speaker selections, and I'm very happy to say that we have only, say, 4, maybe 5 folks that haven't confirmed their date after they submitted their proposals. So we are that close, this close to releasing the agenda, and I'm anticipating it could be on the website by the end of next week, which would be really cool. And then a registration big push once we know all the breakout sessions. They will have contact hours like we did last year. Super easy, bunch of 90-minute sessions. And as Lisa mentioned, it's going to be a very broad agenda. Something for everyone is the plan. So stay tuned for the annual conference update, hopefully at the end of next week. And I believe next we have Hope. Wonderful. Hope, you're up.
Hi, thanks, Drew. I was just going to mention a couple things. The transition for all payer OASIS submissions, up until now, it's been voluntary to submit those, but starting July 1, those all payers are subject to be submitted. So this is going to be everyone that is not under the age of 18, or that you're giving services for maternity, or if it's chores, homemaking. Those are the only ones that are secluded. So you would submit everyone else. And if you have patients that are active and you come up on a recertification or a transfer, you would then have to submit anything that's new past that date, even on an existing patient, not just a new patient. So that is effective July 1. And also, I was just going to mention, a lot of agencies are receiving a lot of ADRs from managed care plans. They're also starting to receive UPICs from Medicare. So these aren't new, but we're seeing a lot of it. So if you need help or guidance or any direction, reach out to the help desk. We're here to help you. That's one of the great benefits of being a member for the council. So I think that's all I have. Thanks, Drew.
Thanks, Hope. And I'd like to mention also that Hope is stepping in with some big help to us on the help desk, helping the help desk. So thanks for all you do there. So you'll be hearing from her probably a bit more often. So it's fantastic. Really glad for that, Hope. And as always, on our website, there is a form. If you go to the provider services, there's the help desk form. That's the best way to get to us. Fill out that form. It goes to multiple staff members at once. It's a lot better than just a single email. So please use that form. Cheryl, also on our expert panel. Cheryl, you had some updates on, I believe it's rules comments
I would like to speak about that. Yes, thank
and
you.
maybe much more. Go right ahead.
I just want everybody to know that the Rules Committee for the Council has been busy reviewing proposed revised rules by the Ohio Department of Medicaid, by the Department of Aging, and by DODD. And we review these rules to make sure that agency providers have a say in the revisions. We have recently submitted comments for the following rules. Incident management, which is 5160 44-05. We submitted comments for DODD extended travel and assistive technology, which is 5123-9-08 and -12. And two biggies that we just recently made comments to Ohio Medicaid last week are 5160-12-02 and 5160-12-03, which are both having to do with private duty nursing. I think all of you should take a look at these proposed rules, see for yourselves how the rule is changing. And this committee meets every other week to discuss rules, and we'll keep you updated as time goes by to other rules that we're making comments on and hope to see changes in the proposed rule. That's all I got, Drew.
Oh, okay, thanks, Cheryl. And it's a great segue into what I wanted to share is some of you watching may be thinking, well, how do I get those updates? How do I hear about that? Well, in the past, we've used our listserv, we've used emails and such, but we have built a new discussion format we call the Council Corner. I say we call it, that's a member voted name and we love it, the Council Corner. We've got some beta testers banging on it right now, and we've had a lot of very good feedback. And I was going to screen share it just briefly if Zoom cooperates with me. So we'll see live and direct into, yes, I think that worked. Fantastic. It's coming near the end of the podcast, folks. We're getting a little ragged here. So what you're seeing is the landing screen for the Council Corner. And we're going to have a lot of groups, groups for home health, groups for hospice. And this is also where our committees are going to be held here. So members will have access to this, and you can come in and you can post a discussion topic. You can network with other members of the groups. We don't have, as that it's beta. We don't have a lot of discussions in here right now, but we have, for example, here's a group, the council news. So we would, for example, to Cheryl's point, if we have an update that we want to share with members, we'd post it here, and people can come in and comment on it, and in the discussions area. Look out for the June bulletin. Yes. So this is very much a work in progress, but we're super excited to be catching up with the 21st century and have a proper place for members to connect, discuss, post updates about your agency, post questions to other members, And like I said, network, because you will be able to see other members that are here and send them messages. So you get some visibility into some of your peer groups. So this is really going to be a lot of fun. So you'll see more announcements about this in the coming weeks. Once the beta testers are done, we've made some fixes. So it will be very soon. So we've been looking to it for a while. The only other thing I already talked about, the annual conference agenda coming out. Our monthly bulletin went out earlier this week. If you did not receive it, it should have come from OCHCH at ochch.org. If you didn't get it, ping me, Drew at ochch.org, and I'll see what the problem is. And that, I think, wraps up our first podcast. Unless anybody else has any other comments to chime in with.
No comments really. I just wanted to point out, the idea of taking this from a live Hot Topics call at 1 o'clock on Wednesdays over to a podcast was to be able to meet you where you are. And you're going to see that more thoughtfully. That's why we've got the council corner. What we're trying to do is understand that we are all extremely busy, likely doing the jobs of multiple people, especially as we continue to try and adjust all of the changes that are constantly coming at us. So you don't have to now try to find time on Wednesdays at 1 o'clock to hit the Hot Topics call. You can listen to this at any time. You can see all of our lovely faces and hear all of our voices and our, frustration right now with what's happening in the Ohio Senate as often as you would like. But that was the idea of taking this from a live Hot Topics call to this type of a call. And we want to hear your feedback. We want to hear from you. Was this a great idea? Was this a terrible idea? Do you hate the fact that you can't actually ask questions during the call? Give us your feedback. I think by now, most of us well enough to know we want to be able to kind of dodge and weave and do the things that you as our association members need us to do. So again, pick up the phone, send us an email, go to the council corner when you figure out how to log in and start using it. And by the way, ladies and gentlemen, that council corner, that's like your, fourth form of social media. So have some fun with it. Just be appropriate. Okay, that's all I got. Happy Wednesday.
Great reminder, Lisa, and really good context for this too. I would like to mention that you'll be seeing different faces on the Hot Topic each month. We'll have some guest speakers. We'll have different team members come and go as schedules allow and as topics present themselves. We may also, as the news merits, have in-betweeners and maybe some quick updates that we're going to have to just get on the Zoom. Like if something happens with the budget coming up in the next couple of weeks, we may just get on a quick chat and get Lisa and get Zach or something and get a message out to you folks. So consider this an ongoing experiment and outreach. So on behalf of the council, I thank you for listening wherever you chose to do so. Thanks, everybody.
Bye, everybody.
Bye.